Good evening. This is Dr. McDaniel back at Chaplip's GYN Corner. Today is Monday, July 8th, 2019, and yesterday I spoke about dense breast. It's a very common statement or diagnosis on the mammograms. So I wanted to go into a second half on it, what the management for it is. I'll give a brief recap. The recap is that the mammogram is an x-ray of the breast, and an x-ray of the breast is done to look for structural changes of the breast tissue and for blood vessel or vascular changes or abnormalities, which can be or will be represented by calcifications or speckling or stippling of the mammogram. The structural changes can be seen as masses, growths, or tissue pattern changes, and the blood vessel or vascular changes are represented by calcifications because abnormal growth garners an abnormal blood supply, and blood supply changes or increased vascularity or new vascular patterns will be seen as stippling due to calcifications from the blood vessel and tissue changes. The mammogram, because it is an x-ray, is not going to be good at seeing small tissue changes as far as densities go. So liquid versus fat is not so easily discernible, or different types of tissue changes. So if there's a structural change or a blood vessel vascular change that's seen on the mammogram, then additional testing is needed. Now, dense breasts refer to the fact that the best breast tissue to evaluate is breast tissue that's predominantly fat. And that's because x-rays go through fat much better than they do firmer, denser, thicker tissue. So everyone, I think, knows that if you do an x-ray of someone's body, the bones will stick out very brightly, and that's because that's the firmest, hardest tissue in the body is a bone. That's come out really bright white. Anything thinner than that or less density, less thickness than that will be a paler shade. So like the song goes, paler shade of gray. Now, the reason why mammograms are recommended for older women, so women 50 and over, at the youngest 40 and over, is because as we get older, most of the firm, perky breast tissue is replaced with fat. So that's why as we get older, our breasts get droopier. And the mammograms are not as good at evaluating or penetrating through really firm, perky, dense, thick breasts, which is seen more commonly in younger women. So women in their 20s and 30s, they can go around without a bra on. It's not going to be a big deal. You're not going to see saggy, baggy, frumpy looking breast. But the older we are, you really don't want to go around with the bra because the breasts aren't going to stay upright. They're going to sag. So the old jokes about the old ladies with the boobs hanging down to the waist, that's because it's mostly fat. It's not connected. It's not firm, dense, fibrous connective tissue. So the mammograms are much better suited to breasts that are mostly fat. Now, that being said, ideally everyone is supposed to get one mammogram between 35 and 40, and then if everything's perfect, it's every other year between 40 and 50, and then every year after 50, simply because our breasts have an increased risk or an increased rate of breast cancer the older we get, especially 50 years and older. Now, if someone has had their mammogram evaluation done, it says the breasts are dense. The issue with dense breasts is that it's going to be more of a whiteout, so you're not going to see a lot of specific features. You're not going to see the stippling as well, the big white spots of calcifications. You're not going to be able to see the pattern as well. You may not be able to see some structural changes that are different kind of shades of gray because it's kind of foggy and blanched out. The mammograms in the best breasts have a miss factor, so they'll say that the breasts look normal when there's abnormal changes, masses or growths, or even precancer cancer changes. That miss rate on average is 15%, and that's in perfect ratio of fat to connective fibrous tissue. If someone has really dense, thick, firm breast, that miss rate is obviously going to be a lot higher. It could even be as high as a 50% miss rate. So if someone is told that they have dense breasts, the most common recommendation is to do an ultrasound or a sonogram. And that's because the sonogram, which I think most people know, if someone's pregnant, they get an ultrasound or sonogram to look at the baby. It can differentiate liquid versus tissue much better. And it can often differentiate, say, if the liquid is blood versus clear water serous fluid, or if the tissue is muscle versus fat. So we can distinguish those much better with the sonogram and ultrasound. So sonogram is done to complement dense breasts to see if there's an area of liquid or a solid area of a mass or tissue change that was potentially missed on the mammogram, because the x-ray is not capable of really making those fine-tooth delineations or differentiations on the x-ray or the mammogram. Now, if someone is young, and young is under 50, I'm over 50, so I can say that. I'm not young anymore. But if someone is young, they're under 50, say they're getting just the screening at 36 to 40, or they're getting the every other year at 40. If they're young and they have dense breast and the mammogram is kind of a whiteout, the radiology physicians will always recommend that they do a sonogram to complement the mammogram. And then if they don't want to do the sonogram, or if potentially the sonogram or the ultrasound does show a lot of thickened areas, or looks like fibromas, adenomas, a lot of masses or growths, then they will recommend that they do, instead of every other year get their mammogram, they'll recommend that they get a mammogram every single year, because you have that inherent high miss rate for them. So everyone has that 15% on average miss rate, but as I mentioned, it could be 30, 40, even 50% potential for miss rate. So it's recommended that they get a mammogram, routine mammogram, to screen for changes every year instead of every other year. And if they're over 50, we're supposed to get mammograms every year regardless. They will usually recommend an ultrasound every year with that mammogram, and then if there are masses or changes or findings, additional x-ray or mammographic evaluation, and potentially even a biopsy is recommended. So I'm going to stop right there on dense breast today. This is Dr. McDaniel at GYN Corner. Please check out the YouTube page. It's also called GYN Corner. Like, subscribe, and comment on the YouTube page. I just updated the YouTube page yesterday, so it's completely up to date all the way through yesterday. There's no lag on the YouTube page. And then when I get a chance, I'm going to try to stay at least at the outside 1 to 2 days behind. I got behind quite a bit, 2 weeks, a little over 2 weeks when I was recently out of the country. Now that I'm back, I'm going to try and stay on top of that YouTube page. The YouTube page is great because everything is nicely delineated. Each of the topics and the subjects is labeled with that one specific topic. On this Facebook page, it's nice, everything's together, but you have to roll through day to day to go back, and there isn't any way to classify them except for the title. So I hope this has been helpful. This is Dr. McDaniel at GYN Corner. Have a great rest of the day. I'll be back tomorrow. Bye.